Hi guys, so the Health Secretary Matt Hancock released some data, so let's have a look at it.
We're going to do things slightly differently today. I'm going to go through the charts. I'm joined by Professor John Newton from the Test and Trace programme, and we'll then answer questions from the public and from journalists. And if there's one message that we have today, it's that it is incredibly important for anybody who has symptoms of coronavirus, a cough or a fever or a change in your sense of taste or smell, that you get a test. Because it's by people coming forward to get the test, which you can get on nhs.uk/coronavirus, or by dialing 119, it's by getting those tests that we're able to identify those who've got the virus, ensuring that you get the best possible treatment, and ensuring that we can then trace the virus, and that we can, through that, we can control the virus.
Now, I'm going to come back in a moment with a problem with what he has said, but let's see what else he has to say.
So that is the most important message and what everybody can do to help to control this virus. If we turn now to the slides, the first slide shows testing capacity and new cases, and yesterday there were 128,437 tests in the UK, meaning that there's been a total of 4.48 million tests that have been carried out since the start of this crisis.
Now, it's very important to know whether these are tests carried out, the data has been produced for these tests, these 128,000 tests, or are they just, is there a portion of these that have been just posted out to the public? Because in later I'm going to show you the process to get the test. You have to request it and it's posted out to you. So what does this number represent?
Now, of course, testing capacity stands at a higher level. Testing capacity stands at 206,444. And this shows that there is extra capacity for more tests, and tests are available right now on the website if you go to nhs.uk/coronavirus, or if you can't access the web, if you dial 119. And I wanted to highlight that because it's so important that people come forward for a test, and anyone who needs a test can get a test.
Now that's very important to remember, which we'll look at later.
The next, if we stay at the previous slide, the next chart shows that there are 1,570 cases confirmed as of yesterday. And this is the lowest number since the 25th of March. In total, 276,000 cases have been confirmed.
Now, somebody on this channel actually brought up a very interesting point. They said that the cases, the new cases at the moment, are roughly at the same place as when the lockdown was introduced. So you're entering the lockdown at a certain number of cases, and you're leaving the lockdown pretty much, you're easing the lockdown at the same number of cases. Now, if we look at this graph, you can see the number of new cases, it's confirmed cases is below, testing is above. But at the number of new cases, it's declining. Now, why is it declining? The simple response is because of social distancing and the lockdown. Now, if testing has increased, so that's good news. So if testing has increased, it means that the lockdown is working because the number of new cases is declining. Now, the problem is that this number on the left, 1,570, this is very high for the number of new cases. And what the government are attempting to do now is they're attempting to ease the lockdown. What's going to happen is, for the next number of days, if things go well, that number will continue to decline, And then in about a week or a little bit later, maybe 10 days, it will start to rise again, because there is a lag on the impact of social distancing and the lockdown. So if we look on the beginning of the graph, when the lockdown was imposed, new cases would continue to rise because the impact of the lockdown there didn't have an immediate effect. So new cases continued to rise, and then a number of days, about 10 days after the lockdown was imposed, we had it began to level off, and then it started to decline. Now it's going to decline for another 10 days more or less, and then you're going to see whether the easing of the lockdown has been a success or a failure. Then if it has been a success, good, continue the way you are. But my problem with this is that the number of new cases is still very high. It's 1,500. For example, here in Italy, the number of new cases today was about 300 or 400. I need to double check the number for today. But it's you're looking at 300 or 400 new cases here in Italy, and we're still maintaining social distancing. The lockdown has begun to ease, but there are still a number of restrictions imposed. In the UK, you're following a similar line, but you're still having too many cases, I think.
Total. But this number of 1,570 it shows that we've seen continued downward progress in the number of new confirmed cases.
And I agree, but that's because the lockdown is working.
Next slide, please. Thank you very much. We're getting this virus under control, and this is why we can make the cautious, small, positive steps that we've been able to make today. And if we look at the number of admissions with COVID-19 to hospital at 479, that's down from a peak of 3,121 on the 2nd of April. And
all of this is because, and this is good news, the number of new hospital admissions is going down, and the number of people occupying ventilators is declining as well. And this is because the lockdown and social distancing is working. That's why you need to maintain it. The problem about this lockdown is in the UK is that it's being eased off too quickly, I'm afraid. And I'm not the only person saying this. Many medical experts are saying the same thing.
The proportion of people on mechanical ventilators, the number that corresponds to that 9% figure is that there are 606 people on mechanical ventilators. Again, that is the lowest since late March. Next slide, please. The picture is repeated across the country, where we've seen in almost every case the number of people in hospital with COVID-19 is the lowest since late March. And as of yesterday, there were 7,541 people in hospital with COVID-19. If we go to our final slide, sadly, 39,045 people have died with coronavirus, confirmed with a positive test. That's 111 yesterday. Again, that figure is the lowest figure since lockdown began on the 23rd of March.
And it's good that it's declining. It's sad that these people have died, but it's good that it's declining. But the problem, once again, is it's declining thanks to social distancing and the lockdown. What you're going to see, once again, is that as the lockdown is eased, that number will continue to decline for a number of days. And then I'm afraid it will start to rise again.
So we can see from these charts the pattern right across the board, which is that on the substance we're making significant progress, but there is still more to be done. And I just want to say a few notes of thanks Thanks to our volunteers responders who in their hundreds of thousands have come forward and stepped up to the plate. Thanks to the charities and the charity groups who are working so hard in very difficult times. Thanks to colleagues in the NHS and in social care. Also to the businesses, the pharmaceutical companies and the diagnostics companies, without whom we simply couldn't have mounted this response. To the pharmacists and the dentists, and I'm very pleased that dentistry is going to
I don't want to be too overly cynical, but this thanking of private industry, private businesses, for the work they have done, is this an attempt to soften the resistance towards privatizing the NHS later on? Look at the great work that the private sector has done for healthcare. Look at what they have succeeded in achieving. That is why we should be heading in the direction of privatizing the NHS. Of course, they wouldn't say it like that. And I don't want to be overly cynical, but it does seem strange how the UK government is constantly congratulating private industry in this regard for the work that they've done on the coronavirus. Now, if they're doing it pro bono, if they're doing it for free, then I congratulate them on that. But of course, businesses don't do things for free. They want something in return. And once again, I don't want to be overly cynical here. Maybe I'm barking up the wrong tree. But we do know that eventually the NHS is going to be sold off. Is this part of the planning?
Start from next week, and especially for their hard work and their understanding, all of the families who stand behind those who are on the front line. And at the start of Pride season, I want to take a moment when we can't get together as we normally would to thank all colleagues in the LGBT community who do so much in the NHS and across social care. I think these data show that the action plan is working. The data show that we're winning the battle against coronavirus. Today, we're therefore able to make some cautious changes to the lockdown rules carefully and safely.
I don't see them as cautious rules. I see images of beaches filling up with people. I see parks filling up with people. I see people in the UK in video footage from Sky News, from Channel 4, pictures from different newspapers online of people walking around without masks on and social distancing not being respected. Now, a lot of people are doing their bit, but the lockdown I don't think is being respected. And I showed some video footage of people going to the beach on Sunday before the actual easing of the lockdown began on Monday, which showed that people were not respecting social distancing even before the lockdown was eased. So I don't think enough people are respecting it, and it's not the time to start easing off the throttle.
Of course, these are balanced judgments, and we take these decisions very carefully. We must all remember that in the war against this virus, we are all on the same side.
What does he mean by that? We're all on the same side. Why, is there someone on the other side? Is there somebody pro coronavirus? I really don't understand what he's saying there. Is he attempting to push the idea that we shouldn't criticize the government? I hope he's not saying that, because that would be extremely worrying.
We've come so far together, we can take these steps together. But do not step too far. The disease is not done yet. We mustn't throw away the progress that has been made. So please take your responsibilities seriously. If you have symptoms, you must get a test. And if the NHS asks you to isolate, you must do so. And to everybody, please, stay alert, control the virus, and save lives.
The usual empty slogan. Okay, but something I want to show you, which is interesting regarding what he had said before. So I'll just bring up the link so you can see it. So it says here, ask for a test to check if you have coronavirus. So it says here, this is from the NHS website. If you go to the NHS website and search for coronavirus, it will tell you how to get a test. So let's just look at some of the rules, or how the process of getting a test. So ask for a test to check if you have coronavirus. If you have symptoms of coronavirus, COVID-19, you can ask for a test to check if you have the virus. This is called an antigen test. There is another type of test, an antibody test, that checks if you've already had the virus. This test is not widely available yet. Okay. So it says here, if you need medical advice about your symptoms, in England, dial this number. Scotland, okay. So this is the way to contact if you have questions. Okay. So who can ask for a test? You can ask for a test for yourself if you have coronavirus symptoms now, a high temperature, a new continuous cough, or a loss or change in your sense of smell or taste. Okay, that sounds reasonable. For someone who you live with, if they have coronavirus symptoms. Okay, that's good. So this service is available for people in England, Scotland, Wales and Northern Ireland. In England and Wales, you can ask for a test for a child who lives with you, whatever their age. In Scotland, Northern Ireland, you can only get a test for your child if they are age 5 or over. So that's fine. If you're asking for a test for someone else and the person is aged 13 or over, check that they're happy for you to ask for a test for them. Please help the NHS by only asking for tests for people who have coronavirus symptoms now. Okay, so it's better to ask for the test. This is what they're saying, if you have symptoms. So when to ask for a test, you need to get the test done in the first 5 days of having symptoms. So remember that there is a period of asymptomatic transmission, but once you start to develop symptoms, you can ask for a test, and it has to be within 5 days, because there is a period where you are no longer symptomatic, or that you're no longer spreading. Okay, so it says here, important, do not wait. Ask for a test as soon as you have symptoms. What the test involves. So the test usually involves taking a swab of the inside of your nose and the back of your throat using a long cotton bud. You can do the swab yourself if you're aged 12 or over, or someone can do it for you. Children aged under 11 cannot do the swab themselves. Their parent or guardian will have to do the swab test. Will I get a test? So they say there's very high demand for tests at the moment. People in hospitals and essential workers, including NHS and social care staff, get priority. Okay, which is okay. I'll come back to that later. Even if you're successful in requesting a test, we cannot guarantee you will get one. It depends on how many tests are available each day in different parts of the country. Now, Matt Hancock said that there was sufficient capacity. Of course, if you have 1 million people ask for a test in one day, it's not going to be possible. So at the end it says, how do I ask for a test? So you can ask for a test online. We'll ask you how you want to get the test. You may be able to choose between driving to a regional testing site or getting a home test. For details, okay, you give your details. And then it says to apply for a test online. You can, apply for a test. To apply for the actual test, you can click here. If you are an essential worker, including NHS and social care staff, are asking for tests for the residents of staff in your care home, or if you have a verification code from your employer. But this is not everyone. So I've read through the entire rules or aspects of, okay, I want to get a test. I read through all of this, and then at the end it says you have to be an essential worker or NHS or social care staff. You have to be asking for the test for residents or staff in a care home, and you have a verification code from your employer that you need a code from your employer to get a test. So this is not everyone. So why did he say, now maybe I'm misunderstanding this website, but I seem to believe here that in order to get a test, you need to be one of at least one of these three categories. Why? Didn't Matt Hancock say anyone who needs a test will get a test? Is this a repetition of what I was talking about some weeks ago, when Matt Hancock said anyone who needs a test will get a test, but he didn't say anyone who wants a test will get a test? I understand there is limited capacity, but you can't say in your press conference, we now are going to give a test to anyone who needs one, or anyone who wants one, because that's not the case. But I've talked about this before. You need to be testing as many people as possible. Frontline staff, NHS staff, okay, but you can't just stick with testing those people. I understand at the beginning when you have limited capacity, test only frontline staff, people who are in the NHS, because they are at the highest risk. But you have to be testing more of the population. Why are you talking about spare capacity, double capacity, but at the same time saying we're not going to test everyone? Now, maybe I'm misunderstanding the website. If that's the case, please correct me on this. But I do suggest that you check out the website yourself. Go to the NHS website and search for coronavirus about testing. But it seems to me that in order to get a test, you need to match the criteria below. And if that's the case, then you're not what you're saying is everyone can get a test if you meet certain criteria, as before. Let me know in the comments, guys, if you agree or disagree with me. As always, your comments are greatly appreciated. Thanks. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun? If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.